Good afternoon, everyone. My topic is the pattern of refractive errors in children of age group 3 to 12 years attending a pediatric ophthalmology clinic in a tertiary eye care center in South Kerala. No financial interest. Now, the refractive errors are the second leading cause for treatable blindness in the whole world. It is also one of the most common problems causing visual impairment in school-going children. With the advent of COVID-19, there has been an increase in the use of on-screen devices, hence a possibility in the rise in the burden of uncorrected refractive errors in children. So the aim of our study was to analyze the pattern of newly detected refractive errors in children of age group 3 to 12 years. So our study was a retrospective study conducted in 2,480 school-going children 3 to 12 years of age during the time of May 1, 2021 till April 30, 2022. The children of age group 3 to 12 years who newly attended the clinic during the study period were included in our study. And those kids who had history of trauma, infections, corneal opacities or cataract, and those who were not willing for cycloplegic refraction were excluded. The details of the children were taken from the EMR, such as the age, sex, best corrected visual acuity, cycloplegic refraction, and the family history were taken, and the refractive errors were categorized into myopia, hypermetropia, and astigmatism. Coming to the result, out of the total 2,480 children who newly came to the clinic, 904 children were diagnosed to have refractive errors, which was 34% among the total. When the age was taken, the average age was 7.2 plus or minus 2.5 years, and the maximum refractive error was in the age group of 5 to 8 years. When the refractive errors were divided, astigmatism was the most common with 61.7%, followed by myopia, which was 34%, and hypermetropia, which was 4.3%. When the myopia was further categorized, it was moderate myopia, which was the most common, with 54.1%. When the refractive errors were categorized according to the age, myopia was found to be more marked after 6 years of age, whereas hypermetropia in younger kids. When the astigmatism were further subdivided, majority was simple myopic astigmatism with 43.7%, followed by compound myopic astigmatism, which was 9.1%, followed by simple hypermetropic astigmatism. When the refractive errors in males and females were almost 1:1. Other ocular comorbidities such as amblyopia in 11.8%, squint in 16.6%, family history of refractive errors in 3.9%, and 2.5% of the kids were preterm. Coming to the discussion, in our study, it was found that 1/3 of the children who newly attended the OPD had refractive errors, among which 61.7% was due to astigmatism, 34% was myopia, and 4.3% hypermetropia. And the average age was 7.2 plus or minus 2.5 years, and nearly equal preponderance for male and female. In a study done by M.O. Ogulahi et al., the total refractive errors was 34.6%, mean age was 10.58, male to female ratio was 1:2, the myopia was 23.2%, simple myopic astigmatism was 21.9%, and compound myopic 20.8%. In another study done by Charavade et al., the prevalence of refractive errors was 16.4%. The overall prevalence was higher among older children with female preponderance, and myopia was most common with 83.5%, followed by astigmatism and hypermetropia. In another study done by Lian Hongpai et al., the prevalence of hyperopia, myopia, and astigmatism were 3.26, 13.75, and 3.75 respectively. And another study done by Sethu Sheila Devi Population-based prevalence of myopia, hyperopia and astigmatism were 5.3, 4 and 5.4% respectively. The limitations of a study is its retrospective nature and a small sample size, as it was a hospital-based study and only new cases were taken. Now the conclusion. Our study shows the high prevalence of refractive errors, high prevalence of refractive errors in school-going children in South Kerala, which is a major public health issue. So more screening programs and interventions should be implemented. And there should be also a creation of awareness of healthy lifestyles and habits. My references. Thank you.
Very good presentation. I have one question. See, in your particular study, there's a very high incidence of astigmatism.
Yes.
As compared to all the other studies, you had a very high, around 70%.
Yes.
So how do you explain that?
Sir, we didn't take the old cases which came to our OPD. Only new cases were taken. So,
No, but still, 70% of astigmatism is very high. So you also said that because of increased screen time and all that. But
yes.
what do you think? Why is the astigmatism more important in these patients, in these kids?
Maybe due to COVID, because it was COVID times, there more strain, eye strain and all.
Okay.
And we only took the new cases which came to our OPD. The old cases were not considered.
And you feel that there can be a geographic change, because you specifically said Kerala. So if you take it in Karnataka or any other place, do you feel that it will change?
Yes, maybe.